Good morning, everybody. Excuse me. My name is Lisa Bowen, and I am the Community and Partnership Training Lead for Change Grow Live Camden. We are drug and alcohol treatment services. I'll tell you a little bit about us. We've been in the borough probably 20 years now. We used to have a very small drug service over on Camden Road near the Overground, and a separate alcohol service. And there was another big service, the NHS service, that was down on Hampstead Road, but we took over from them 2 years ago. So now we're just one big integrated service down the far end of Camden High Street, down near Mornington Crescent. We've got another little service over in Kilburn. We provide support for people using drugs and alcohol within the borough, so right across the borough. We work within doctor surgeries, we work in hostels, we have a women's service, we work with homeless teams, we work from 18 to over 18, but we have also provision to work with younger services, younger people as well, via other services like New Horizons Young People Service and Forward. So I'll talk a little bit about Camden actually before I talk about what we do over at Change Grow Live. So Camden is a pretty unique town. I'm sure lots of you won't be massively surprised when I tell you that it's a big super party town. It's the second biggest nighttime economy in the country. One of the biggest nighttime economies in Europe. It's famous for its clubs and its pubs, its bars, its music. There's a lot of tourists here. There's the market. It's really been regenerated and done up, and it's a destination. So lots of people come here to enjoy the nightlife and everything else that's on offer. Camden as well has got the highest rate of people over 55 using drugs. So we have an aging population. There's a lot of people living longer, a lot of people still using drugs and alcohol when they're older. And it's a lot of people drink. We have a drinking culture in this country, as I'm sure everyone's aware of. So you have that, but we also have a lot of people in Camden taking drugs that are over 55. Another statistic about Camden is we have the second highest rate of isolation in the country. And the thing about using drugs and alcohol problematically is that it causes people to isolate, be cut off from communities. And it could be, is it substance use that makes people isolated, or is it isolation that draws people to use drugs and alcohol in the first place? The same could be said around mental health. Is it drugs that cause mental health issues, or do people use drugs because of the mental health issues? We try not to, we try to work with all the intersections there without discriminating either or, because what we found over the years is that people were falling through the cracks, because it was like, we can't work with this cohort because we're not mental health services. And mental health services say we can't work with this cohort of people because we're not drug services. So what we do now, we have a much more wraparound support network in place for all clients, and we try to work, with as many clients as we can. So Camden has a lot of people coming here to take drugs. A lot of people come to Camden to sell drugs. A lot of people come to buy drugs. So what we would call drug tourism. I don't have enough time to go into the details of it, but there's a lot of cuckooing in the borough. So back to talking about communities that are isolated, people that are vulnerable, having their properties taken over by people that are storing drugs or selling drugs. People that are vulnerable are lonely. If they're using problematically, they're being given drugs and then having their properties taken over. There is a lot of modern slavery and trafficking going on as well, which ties into the model of people selling drugs. and as well as what we know is the county line models, as well as a lot of people getting groomed into gangs across the borough. So, you know, we have a lot of criminal gangs operating within Camden selling drugs. You know, it's big business. I'm not being cynical here, but you know that it's a huge market, and there are so many different drugs on the market now. The thing to remember as well is that people start off taking drugs because it's recreational, it's fun, it's enjoyable. Often people don't know what they're taking. A lot of people become dependent on drugs because they're addictive. You know, go figure. And back to what we were saying before, whether it's peer pressure or people are self-soothing, self-medicating, taking drugs because they're enjoyable. What we work with in Change Grow Live is when it's tipped over into not being enjoyable, it's become habitual, it's become risky, and it's really affecting people's lives. So we work with, you know, we're seeing a lot of changes in the drug market, and what a part of my role as the community and partnership training lead is working with harm reduction. So we don't condone taking drugs, and we don't champion it. So we're not saying do it, don't do it. We're saying if you are going to take drugs, you know, we want to provide really good harm reduction, harm minimization advice and support, so that people are armed with the facts about what they're doing, as well as offering support for people if they're drug taking. And when I say drugs, I mean alcohol as well, if it becomes problematic. There's been a steady rise in synthetic drugs in the last few years. Basically, this is synthetic opiates, synthetic cannabis, you know, things like ecstasy and MDMA and methadone and what used to be called legal highs, which are now illegal drugs. So these are drugs that are copies of organic drugs, so things like cocaine and heroin and cannabis, which are grown in, you know, huge crops. They have to be harvested, they have to be processed into the raw compound that makes those drugs. Then they have to be smuggled into the country. When you make synthetic drugs, you can do it domestically, which means you can make these synthetic drugs within places in the UK. So it's like, you know, it's much more profitable, it's easier to shift them, but it's far more dangerous. So what we are seeing a lot of in Camden at the moment is synthetic opiates. About 2 or 3 weeks ago, I think we had 40 people across the borough overdosed on synthetic opiates, which the police were able to track back to one line. Now, a line is a telephone line. So it'll be one person with one telephone number on one telephone line who is dealing drugs from that line. And it was all traced back to this one line. Luckily, nobody died from that. But you know, part of our job is when we have these drug alerts, is to do like a coordinated approach with all the health services across the borough. So you know, we're seeing a lot of heroin is now being cut with synthetic opiates, which is about 200 times stronger than normal heroin. So the risk is really high. But we're also seeing people that are using crack, who are Justin, I can't hear anything.
Right. Sorry about that, Lisa.
That's okay. Justin, I hope you can hear, but we are recording it.
Yeah.
Just to pick up where I left off. So we are seeing people that are using drugs that are stimulants. So heroin is an opiate, it's a slow drug. Cocaine is a stimulant, it's a fast drug, but we're seeing people, because you know, we drug test people as, you know, part of our clinical practice. We're seeing people that are taking things like ecstasy, things like cocaine, smoking spice, and it's all been adulterated with these new synthetic opiates. So people are overdosing on drugs that aren't drugs you would normally overdose on. So it's you know, it's of a real concern, and you know, synthetic drugs are really kind of infiltrated the whole market. And we're seeing a lot of people taking cocaine. There's a lot of cocaine in the country now. You know, I'm going to keep going on about all the dubious statistics of Camden, but Camden and the UK as a whole is the the biggest cocaine using country in Europe. There's a lot of it here. It's very strong. It's very plentiful, and it's a lot cheaper than it used to be. And it's much more normalized now. You know, we would normally think, if you ask people who takes cocaine, it's wealthy people that have got a disposable income, drink champagne and you know, drive a Bentley. Absolutely not. It's, you know, we see it intergenerationally. You know, we work with families that have got children in their 20s, parents in their 40s or 50s, and grandparents in their 70s who are taking cocaine. So it's kind of crazy. You know, we work with a lot of people that are taking ketamine. So ketamine is an anesthetic. It's used as a tranquilizer for animals. It's used as a tranquilizer for babies. It's a painkiller, and it's quite short acting, and it doesn't give people a hangover. It's, you know, there's not nasty side effects. So when you're thinking about people that might use drugs, you've got to think about the efficacy of the drugs, you know, and to speak about if you're using drugs because you're getting something off them, if they are short acting, you don't have any nasty hangover, and you can get on with your life afterwards, it's, you know, you could understand why people might use it. But ketamine's really addictive. We've got, I think, about a 30 excuse me, a 30% rise of people in the last 2 years, about 30% rise of 16 to 24-year-olds taking ketamine. And it causes a lot of bladder problems and kidney problems. So it's this, you know, we're having a health emergency emerging in real time as we're working. So, you know, I just wanted to give you a bit of an overview of what it's like in Camden. You know, when we've got all of the normal drugs, when I say normal, it's the more common ones. So there's a lot of people smoking weed. You know, and there's a lot of weed grown in this country, whether it's people growing it in their attics, you know, in abandoned houses or renting houses. It's, you know, it's about it brings in over £2 billion a year in terms of people's revenue that they're making from it. And, you know, we see things like, if you see pictures of a cannabis leaf and a QR code stuck on lampposts, if you held your phone up to that, that would take you through to a link where you can buy cannabis. It's honestly, it's hair raising if I told you some of the things that are going on, you know, and because it's big business, and because people are taking drugs because a lot, you know, they want to a lot of the time, and that's where we step in. So we provide, we've got about 1,000 clients now. We're a big service. We probably have 65 staff. We have a team of doctors and nurses. We have a psychologist. We have a psychiatrist. We have a counselling service as well. And we have a service called Some Space that works with people that are affected by someone's substance misuse. So, you know, there is a ripple effect caused by someone that's addicted to drugs and alcohol. So it could be the parents or the partners or the friends or the children. They can, you know, they can come to us independently of that person. That person doesn't need to be in treatment with us. So we have that service as well. We prescribe opiate substitute therapy. So what we do for people that are addicted to heroin, which causes people's, you know, like real severe impacts on people's lives and communities, we provide opiate substitute treatment, which is things like methadone, to replace the heroin and the behaviors that go with trying to get money to get heroin, because it's really addictive. When people are in withdrawal, excuse me, they feel really traumatized and very sick. So that's what we provide for that. We have a dedicated alcohol service. We do community alcohol detoxes. If the high risk drinking if it's not too risky, we can do that within our service. You know, and we can refer people to detox and rehab. We run lots of different groups across the week. We do like cannabis group, alcohol group, sort of drug specific groups. And we do a prehab group. So we copy what the groups are like within rehab, so that people get a taste of what it's like when you go to rehab. You know, we don't want people to have false assumptions about what rehab's going to be like, because it's hard work. You know, it's a minimum of 3 months away from home. No drugs, no alcohol, no telephone for the first month. You know, it's hard work, and people have to really get honest and dig deep about you know, making positive lifestyle changes, you know, and it's a really profound, life-changing opportunity for people as well. So we want to make sure that people are ready to go. We have a lot of key workers who are trained to work with, you know, structured treatment. So, you know, that we'll have a key work session every week or every 2 weeks. We can do telehealth. So we do work, you know, like key work on the telephone. We've got an LGBTQIA plus team and worker. We have a dedicated women's group that takes place off the site. And we do a lot of things that aren't just around drugs, because we really want people to have some what we call recovery capital, which is interests away from, you know, because drug addiction is all consuming. It's to try to get people to, you know, access other things in the community. You know, and Diane and I were talking about this earlier. Camden has so many resources. So we do work a bit like what the care navigators do. We kind of signpost people within the borough to all the different things that are on offer. We work with SHP, which is the Single Homeless People's Project. They very much work with aftercare. So people that have gone through coming off drugs and alcohol, and then it's a bit like they're at the next what next stage. They work with that. What else have I got on my slides? Let's have a look. Hold on. Yeah, so we also have a service called Rest, which works with people that are addicted to sleeping tablets and tranquilizers. That's run by the service users, and it's been going for years. It's a very popular group. And yes, so I mentioned SHP. We also work with an organisation called SWIM, which is predominantly aimed towards Black and ethnic minority communities. We work within prisons as well, so we have a criminal justice team. And our organisation used to be called CRI, which was Crime Reduction Initiatives, because many years ago, probably 30 years ago, we'd seen that there was a massive gap in the service provision for people that were coming out of prison, and they were just going straight back into the communities with no support, using drugs and alcohol again, and ending up back in prison. So we work in the prisons and in the community and in probation so that we have joined up working and real support networks for people who are in the criminal justice system. What else can I tell you? So it's really easy to refer in. If you see the slide that you're looking at now, you can go onto our website and it will tell you all about the different treatment options we offer. You can self-refer, or you can refer your clients yourself. As I said, we're based across Kilburn and Camden, so we cover both sides of the borough. We have a dedicated team, which is called the Entry into Services team, who work with the referrals, and within 2 weeks, the person that you've referred in or has referred themselves in would have been assessed and had an initial appointment. You know, we do rapid prescribing as well for people that need to get onto a methadone prescription. Part of my job is training within the community around all stuff around people that are using drugs. So it can be basic drug awareness, working with people that are using alcohol problematically, all the different specific drug groups, working with younger people. You know, I train within the universities, which is a lot of stuff around like harm minimization, you know, spiking awareness, you know, keeping yourself safe when you're going out. And also supporting teams and also supporting people to work with people that are using substances problematically, you know, because, you know, we a lot of us are frontline service workers, and we feel the impact of services being cut and how much more we're supposed to do with less money. You know, and I'm really interested in people not getting burnt out doing this work. What else could I tell you? Yeah, I think that's it. We're down. We're on a big service down at the back of Camden High Street. We're down off Plender Street in the Mews. We have an open access service so people can drop in if they want to come in. It's a big service, you know, we've got a lot of stuff running there all the time. We have a breakfast club in the Pirate Castle on a Friday morning. So we do things off site as well, like art groups, film club. We have poetry groups, reading groups, just, you know, just to keep things interesting and creative. Those are my details. So Diane is going to send these out later. So if you're interested in any training, the training is all free. Any training for your teams, or you'd like to know more about what we do, or you've got questions about someone you might be concerned about, you can email me or give me a call and I'd be happy to support with anything. And I think that's it, Diane.